Welcome to the Radiology Vault, an open repository for radiology educational content designed for learners and medical professionals. Presented by the Michigan Medicine Department of Radiology.
Welcome to the University of Michigan Department of Radiology Vault, a collection of short radiology lectures. My name is William Weadock, and I'm one of the abdominal radiologists at the University of Michigan. Today I'm going to be talking about an introduction to 3D medical printing. I have no disclosures. What is 3D medical printing? Well, it's similar to inkjet printing, but it uses plastic or some other material instead of ink, and it slowly builds an object by successively adding materials. In this case, on a lateral view, the yellow material is added successively. The white material is an area of overhanging edges, which is the support material, which can then be removed, resulting in a 3D object. The steps to create a 3D print include starting with a CT scan, creating a 3D model, and then doing a 3D print. These steps we will now review. Image acquisition for CT or MRI is very important. It requires a high contrast image with high resolution at 2 millimeters or less slice thickness. With CT, there are fewer artifacts, and with MRI, there's no radiation needed. The segmentation of the objects is similar to what we previously use in medical imaging. In the image on the left is a volume rendered image of the left kidney, and the image on the right is the segmented STL file. Segmentation of objects is similar to what we typically do in medical imaging. In this case, the left kidney is selected as shown by the tinted red area. And in this case, the kidney is segmented and tinted in blue, resulting in the 3D model on the right-hand side. We can then segment the aorta and left renal artery and add it to the model. We can then add the collecting system and proximal ureter in yellow, and the inferior vena cava and left renal vein in blue. The tumor in this case is segmented and shown in purple, and this results in our final model, which would be ready to print. The standard tessellation language, or STL file, as I showed, was created from medical images, and creation of these files is built into many 3D medical software suites. This is a computer-aided design type file, which can then be edited, cut, or other things. Eventually, the file can be printed on various different types of printers. The STL surfaces are all made of small triangles, as shown in this kidney picture. When I show the triangles on this wireframe image and a zoomed up image, you can see that each of these surfaces is created by various sized triangles of different size and shapes. The 3D printed model and print are shown here as an example. It's important to do a 3D model quality control and review the model overlay on source images. In this case, the left kidney, the tinted part, shows that the model will be an accurate representation of the patient's anatomy. After the print is made, quality control is again performed, showing measurements and a visual review to again make sure that the model is an accurate representation of the patient's anatomy. How to get started with printing? First, you can buy a printer, which range in costs from hundreds of dollars to hundred thousands of dollars, or you could use a printing service, which there are multiple available on the internet. You would email or upload the files, and in this case, you could try out different materials, but be very careful not to include patient information in either the file names or the images themselves. Medical applications of 3D printing include education of the clinician and the patient, surgical planning, and also surgical guides. Simulations for surgical training, prosthetics, implants, and bioprinting are also possible. An example of multiple bilateral renal cell carcinomas in the model on the left-hand side shown in yellow, and on the printed model in white on the right-hand side. In the patient here, there's multiple anatomic variants present, including 2 left renal veins, at least 2 left renal arteries, and the tumor, which is depicted in green on the left side and sort of a transparent yellow on the right. In conclusion, 3D medical printing is rapidly progressing. The clinical applications are exploding. The software is rapidly improving, and printers and material choices are increasing. This is a great time in medicine, and smart, creative people are making a difference. This is truly history in the making. Thank you very much for your attention.